Hello and welcome to the presentation looking at reactive tendon. Tendon problems are common in runners and can become a persistent issue if they're not treated properly. In recent years, our understanding of the pathology of tendinopathy has grown, and we now know that it isn't really an inflammatory process and that load plays a large role in it. We also know that it's important to determine the stage of the tendinopathy, and this will have a huge influence on how we manage it and how we treat it. So Jill Cook and Craig Purdam have been at the forefront of tendinopathy research for some years. They released a paper in 2009 that outlined a model that described three different stages of tendinopathy. And these are reactive tendinopathy, tendon disrepair, degenerative tendinopathy. And it's really helpful to think of these as a continuum rather than three completely distinct phases. So let's just have a look at the continuum in a little bit more detail. So we have reactive tendinopathy, which we're going to discuss in a little bit more detail. And that typically involves the tendon responding to a rapid increase in loading. We then have tendon disrepair. We can have early disrepair and late disrepair, and we can have a reactive early disrepair tendon as well. But tendon disrepair is usually the stage that would follow reactive tendinopathy. If the tendon continues to be excessively loaded, it is similar to the reactive stage, but the tendon structure begins to change with greater matrix breakdown. Then we have degenerative tendinopathy. This is more common in older athletes. It represents the response of the tendon to chronic overloading. There are multiple tendon structure changes, making it less efficient at dealing with load. Collagen becomes disorganized, and an advanced matrix breakdown takes place, alongside further increase in vascular and neuro ingrowth. The tendon can appear thickened and nodular, and there's a risk of tendon rupture with advanced degeneration. So let's have a look a little bit more at reactive tendinopathy. Reactive tendinopathy typically involves the tendon responding to a rapid increase in loading. For example, with runners, this often means a large increase in mileage, a reduction of rest days, or a change in training type. So, for example, introducing hill or speed work. It can also be from direct trauma to a tendon. Now, it was thought that this reaction involved inflammation, but we now understand that this is not the case. The tendon does swell during reactive tendinopathy, but it's due to the movement of water into the tendon matrix and not inflammatory products. A key feature of a reactive tendon is that structurally it remains intact, and there is minimal change in the collagen integrity. So in simple terms, it means that a reactive tendon is usually a reversible process. So let's have a look at how we manage tendinopathy. So reactive and early repair phase. So the most important treatment in this stage is load management. This means reducing both tensile and compressive loads on the tendon. Now, tendons connect muscle to bone, and as a result, are placed under a great deal of tension during activities that involve the muscle contracting or resisting a stretching force. This is what we mean by tensile force or tensile load. Each time your foot hits the ground during running or playing sport, your body has to deal with an impact force equal to roughly 2.5 times your body weight. But fortunately, tendons are thought to be able to withstand up to approximately 8 times our body weight. Now, runners or anyone playing sport can reduce tensile loads simply by decreasing how far or how fast we run, or taking a rest from running if required, or playing sport. However, tendinopathy often has a compressive element to that also needs to be addressed. For example, proximal hamstring tendinopathy. The tendon is thought to be compressed against the ischial tuberosity when the hip is inflected. So, for example, when we are sitting. So reducing time spent sat is a simple way to reduce that compressive force. Also, it's really important in reducing movements that combine both compressive and tensile loads. So managing load doesn't mean completely offloading the tendon, so hopping around on crutches or sitting there with your leg up, but reducing the load to a level that allows the tendon to recover. This may mean rest from running or modifying training, depending on the severity of the tendinopathy. So the reactive stage or reactive tendinopathy can be relatively short. So pain may settle in 5 to 10 days, but the tendon will still be sensitive to high loads and training needs to be progressed gradually to prevent a relapse or a re-injury for that athlete. What's really important is when managing load, be guided how the tendon responds, not instantly, but also looking at it 24 hours later. Tendons are known to have what we call a latent response to loading, and that means it can take 24 hours or more to react to it. So bear this in mind when you're working with your athlete or yourself, or when you're progressing that rehabilitation program. It may feel fine at the time, but react the next day. Thank you for listening.